MAP spends a lot of time at the intersection between payer, provider, and patient. And that insight and that unique insight has given us the ability to really understand what kind of information would we consolidate into one location if we could. That's what this is. So I think this is going to be a helpful guide to really illuminate some of the successful ways to navigate the new healthcare paradigm.
We organized the 10 questions so providers and payers could systematically walk through those questions and answer them so that they could identify strengths, they could identify weaknesses, and also strategies to keep pace with the way the field is changing. You can't treat those suffering from addiction, which is a chronic brain disease, with an acute model. You need to extend the continuum of care in order to meet the needs of somebody who is in recovery from a behavioral health issue or recovering from a substance use disorder. It's so important. We know that people are very vulnerable within the first 12 and 18 months post them getting out of some kind of acute treatment facility. And so in that 12 months to 18 months post-treatment, they really need to be offered support, individualized support, to help them navigate the difficulties of that recovery process. Without that support, it leaves them incredibly vulnerable to regression, to relapse, and to be needing to go back to an acute care model. If we can extend that continuum of care, we increase the probability that they will continue on and do well and maintain wellness, maintain their recovery over a long period of time.
Employing an acute treatment model for a chronic disease is a recipe for disastrous clinical outcomes. And the most immediate action we can take to improve outcomes in this space is probably to extend the care continuum and have a chronic preventative care model for a chronic disease. And that's something that I think population health is really going to help drive and really illuminate the pathways and the KPIs, the key performance indicators that really drive how to effectively do that. Fundamentally, population health management is rooted in mathematics. It's utilizing math to understand what's working, what's not, clinically, economically, so forth and so on. So I think that a lot of the truths that are found in this paper are going to be timeless and relevant over the entire life of the space. And secondarily, we're bringing a lot of attention, I think, to topics that those in the space may not be completely aware or relevant to them. And we're going into greater detail around some of these topics, and I think providing information that's really useful for payers and providers to leverage to be successful in their respective endeavors.